I would like to thank Dr. Joseph for that. At this time, I'll call on Mr. Humberto Brown, who is the Director of New Constituency Development and Health Disparities at the Arthur Ashe Institute and the Seminar Series Director for the Community Engagement Corps.
Good morning. Good morning. Are you all awake? We all here? You with me? Great. It's been a good morning, and it's a very special moment because one of the things we learned in the Health Disparities Center and the Arthur Ashe Institute is that over the years what we learned from the community is something I personally learned in my personal life. First, that we are very diverse and that respect means to understand diversity and respecting each other. So I want to start saying good morning again. I want to hear you. Good morning.
Good morning.
Buenos dias. Bonjour. And because some of us grew up in countries that we speak 3 languages every day, all the time. And your Jamaican grandmother tell you must speak English. And the Martinican one say you must speak French and Creole. And you get to school and they say Spanish is the official language of the country. That's what you negotiate in this fragmented reality of immigrants and reality. And this morning, we are doing exactly trying to move from words, concepts, to reality, to practice. So what we have learned in all these years of doing this work is that the community was tired of hearing promises, concept, titles, and in Spanish we have a saying in Latin America that says, amor son hechos y no dichos. That love is a practice, is an action, not words or slogan. That they wanted to see something that mattered to them, something that makes a difference. But to do that, we had to recognize that the relationship has a long history and inequality and distrust. And that's what the Arthur Ashe Institute role is and has been, is establishing relationship among equals and addressing what Dr. Farmer from Harvard called the pathology of power, the first pathology that impacts health for all. So what we did this morning is learn from what we were told, that the community always get recognized in another space and another time. They never participate in the main hours when all the advertisements are paid for, as the Super Bowl. And we're doing that this morning. We decided to bring them up front and share with you and recognize the people that make this happen. It's also want to recognize that this did not happen because they were a brilliant intellectual with 4 PhD at NIH that decided that community needs to be involved. Is that this came from the community reacting to about 20 years, between the first 10 years of reducing health disparity, and then from the 10 to the now to going to 2020, said that everybody planned, everybody discussed, nobody included us, nobody consulted us, nobody asked us. And this community over the years insisted that they need to be included and have bi-directional conversation, consultation, and understand what they consider priorities. So this community engagement is not an abstract concept. It comes from community demanding, asking, requesting that to participate, they had to be included. Before I mention the list, I want to share with you something, because sometimes when we talk about community, we also reduce community. Community is diverse, it's complex, multilingual. We're in community, and we're dealing with community that are confronted historical problem that we all know. And when we go and do that work in the barbershop, in the salon, we are faced with those social determinants that the World Health Organization recognize as definite things you have to do if you want to address health inequities and health inequalities. Because disparity is just a reflection of inequalities. And that's what we are trying to address, and that's why the community is here. And what they said, before I mention these names, and they were describing how homeless people describe how they see they're treated in community. And they said that they always felt neglected, avoided, ignored, denied, overlooked, feared, detested, pitied, and dismissed. That they live every day of social debt. So when we construct a new relationship, that's what we're dealing with. We are in the out front dealing with people understanding fundamental issues and letting them become empowered to become equal partners in addressing things according to their understanding and their knowledge, and that we need to invest in making them equal partners. So we started in a little contribution to this, recognizing the people who make the Arthur Institute realize some of our dreams, implement some of the projects that we want to do, and continue to broaden the vision of academia and other institutions about how you address health inequities to achieve the elimination of health disparities. I'm going to mention first our Community Advisory Board. It's a group of people who have always supported us, participate in all aspects of our work, give us ideas, question, challenge, criticize, but always there with us, and we want to honor their role and all the hard work that they do with us. The American Cancer Society. As I call people, they should come up to the podium to get their certificates. Please, join us. Arab American Family Support Center. Brooklyn Center for Independence of the Disabled, Incorporated. Brooklyn Perinatal Network, Incorporated. CAMBA. Caribbean Women Health Center, Incorporated. Community Counseling and Mediation. Diaspora Community Services. East New York Farm United Community Center. Greater Brooklyn Health Coalition. Got it? Haitian American Community Coalition. Make the Road New York, Incorporated. And People Institute for Survival and Beyond. Okay, now we're going to list a lot of the barbershop and salon that are part of a lot of the project and research that we do. Recruitment, all those things are done with our community. And we want to honor them this morning. I want to call your attention that I'm happy that we're spending some time with the community and spending time giving them quality time. A lot of them did not make it to this meeting, but these are one of the challenges of working with community. They don't have academic hours. They don't have university hours. They have to work in barbershop and salon. That Friday is a big day and have many things to do, family, kids, before they get to the shops. So we have some of them came, but the others we honor them equally because we know that they live in the other world that some of us never visit. So I want to mention the group of the of both the salon and the barbershop. BB Unisex Salon. Black Success Barbershop. Brooklyn Finest Barbershop. The ones that are here will show up. The others, we just want to mention them for everyone to know that they're participating. Creative Unisex Salon Incorporated. Dr. Klutz Unisex. Exceptional Hair Care Salon. Executive Barbers. Gentleman Quarter Salon. Goldie's Barbershops. Hermie Beauty Salon. High Profile Barbershop. Just Hair Incorporated. Cut Zone Incorporated. KZ and C Barbershop. La Cruz Unisex Barbershop. Leroy Barbershop. Level 1 Beauty Salon. Natural Roots Barbershop and Beauty Salon. Omaka and Z Barbershop. Platinum Cuts Incorporated. Royal Ambient Salon. Short Task Unisex Salon. Vernon is ear Beauty and Barbershop. Exclusive Hair Cutters Barbershop. St. Augustine Episcopal Church. St. Paul Episcopal Church. As you can see, we include also faith-based organization. They're fundamental in our community and at the base from a lot of the social programs that our community receive. And they are the people who normally can tell you what is the real problems beside the one that we are imaginary. David V. from SSC, here. Okay. St. Augustine Church also. And we're going to end with, as you're saying, we are starting a practice that we hope that all institutions who work with community try to do is not, again, practice, practice, practice. So we honor. We want to also give some award. We have given award before at our sport ball, which is our main fundraiser. Major event that we do, we always try to include our community. So we want to give some special award because these are people, we have done others before, so we just adding to the list of people who participate in multiple projects. They're here all the time when we're doing survey. They do recruitment for us. When we have issues of trying to test questions and understand what's happening, they're always there, even though they have very busy schedule and they're not in any of our grant and I have any 1%, 5%, 25% from any of these grants. They're there because they're committed to the community and they believe that they can make a difference in the quality of life of their community. So we wanted to honoree for these awards. I'm going to read and please come up for the plaques. Brooklyn Finest Barbershop. Exceptional Ear Care Salon. Executive Barbers. Level 1 Beauty Salon. Royal Ambience Salon, Exclusive Hair Cutters Barbershop, St. Paul Episcopal Church, or United Methodist, okay. So these are our the recognition that our community is part of this, and that we will continue to practice that partnership is like sharing power. I want to end reading to you all, and I want to say it's not my concept, because if I say it is a radical concept, is by Kellogg Foundation, what we mean by community-based participatory research when we talk about community. Community-based participatory research is a collaborative approach to research that is equitable, involves all partners in the research process, and recognize unique strengths that such and each of us brings. CBPR begins with the research topic of importance to the community, defined by the community, as the aim of combining knowledge with action and achieving, is important, not just an exercise, and achieving social change to improve health outcome and eliminate health disparity. Thank you very much.
This is great. Thank you very much, Humberto, and thanks to all the community partners. Without you, we would not be able to do what we are doing right now, and we appreciate you, and we would be happy to invite you for next year's conference. I particularly liked the comment made by Saida. She said the communities must demand the research. I think that is a very good twist. If the community doesn't have the research done for their problems would never be highlighted. I think that is a very significant contribution this morning, and we should all remember that. Okay, so now it's time for the meat, the red meat. We have an incredible speaker this morning, and he is really the keynote speaker for the conference. And the way we structured the conference is slightly non-traditional. We just didn't want to bombard people with lectures and lectures. We wanted to give you an overview and then create a panel of discussion so that it will be open discussion. Everybody will bring your questions, whatever you have, you can bring to the panel after the discussion, after the presentation, and then we will hear everybody's perspective, and then we'll discuss it. That is the style we are trying to achieve today. So I'm really very happy and proud and honored to be standing here to introduce Dr. Thomas LeVist. Dr. LeVist is the William C. and Nancy Richardson Professor in Health Policy and Director of the Hopkins Center for Health Disparities Solutions at the Johns Hopkins Bloomberg School of Public Health. I hope you remember that. The CV is really long, so I don't think I should go through everything. I think this guy is highly accomplished. He's directing one of the best disparities center in the country. He's going to share his thoughts about this subject with us. He's published widely in many, many public health journals at the bottom of the brochure. And I think we are so happy and proud to have him with us. And please join me in welcoming Dr. Thomas LeVist.